Good morning and welcome to Understanding the Human Condition. I'm Shay Butts. I'm your host today, filling in for Dr. James Flowers. I'm the Chief Experience Officer here at J. Flowers Health Institute, and I have the privilege and the pleasure of being joined by our friend and colleague, Dr. Frank Chen. Dr. Chen is one of our psychiatrists here at J. Flowers Health. He's board certified by the American Board of Psychiatry and the American Board of Neurology. He's the Chief Medical Officer at Houston Adult Psychiatry and Houston Behavioral Hospital. And would just like to say welcome. Good to have you.
Thanks, Shay. I think we bump into each other quite a bit in the hallways, and it's great that we're sitting down and having a conversation.
So normally we have a kind of a little witty banter that goes on, and we have a lot of fun together. So we can do some of that today, but
Sure.
we have to keep our professional hats on too.
Thank you.
So anyway, I'm really excited to have you here. I think that you bring so much to the table as one of our providers, and we tend to throw you cases that are fairly complex. And so I appreciate your ability to jump in and just be really creative in your approach.
Now, I like the challenges. They're the fun ones, right? And
Yeah.
really, they make me think a little more. And that's part of the exercise that I get out of this, because this is a very unique population, and sometimes you do have to think about what's happening behind the scene with the developmental background of someone that may contribute to coming here. So yeah, I really do appreciate if you guys want to call it the harder cases, but they really allow me to be challenged.
Right. Right. Well, the thing that I like to also, when we have guests that come on, I like to talk to people about things that are personal to them.
Sure.
And so what we're talking about today is caring for the caregiver. And I know that you have your own experience, not only as a professional, but also as a son, right?
Sure.
Would you like to tell a little bit about your story? Or?
Yeah, so I immigrated to the United States back in the 1980s, and like a lot of things that came to the United States in the 1980s, I have this big stamp that says "Made in Taiwan," and so from an early age, I spent time in Los Angeles and very much got into the culture over there. But there's something in the background that was always kind of influencing me, this pervasive cultural issue of being in the United States, being Asian American, and having to be kind of stuck in two different cultures. I try to flee from some of that as much as possible. In my early years, I went far, far away from my parents, and I went to the Wharton School at the University of Pennsylvania. The ironic thing is that the business school education actually was a platform to launch me into medicine. And it sounds illogical, but that's how sometimes the cultural influences work.
Well,
Right?
so tell me what you mean. The business school actually launched you into medicine. So how did that happen?
So, I talked about this familial influence, this cultural influence. They wanted their number one son to be a doctor.
Right.
Right. And so
No pressure.
no pressure. Right. And so you're stuck. You're stuck between, doing what you want to do, or what you think you wanted to do at the time, and, fulfilling some obligation. And it's actually quite powerful, the influences that your parents have on you, right? Even into your 20s. And so there was a struggle for me thinking about going to med school. And I did. I got into med school, but there's always sort of this conflict that I struggle with, am I at the right place? Now, as a psychiatrist, practicing for the last 30 years, I look back on that, and really, that's not something that a normal 20-year-old would not struggle with, right? I mean, so many 20-year-olds in their quest to find their identity, they think about what they want to do. They think they want to do something, and they end up doing something else instead, right? And that's all normal, but it's, there was a very regimented path forward when you get into med school, and it always seems like it was very difficult to break away from that. And I think that part of this unconscious conflict that I experienced was probably what ended up attracting me to the field of psychiatry, right?
Okay.
To kind of conquer this conflict, if you will, right? Now, I know now that in order to conquer this conflict, you get a good therapist, right? It's not something that you can do on your own.
Right.
But I do think that, the sense of being lost at that age, and the sense of wanting to do something else, the struggles that 20-year-olds have. I wish I could tell every 20-year-old, get started in therapy early so that you can kind of be a more secure self.
Yeah, just
and
help process your life and the
correct.
things that are going on and those big challenges and big life decisions
Right.
that we make when our brain is not even fully developed.
Right.
So-
So often, we feel like we have to fulfill a path, right? We feel like a failure if we deviate from that path, right? And sometimes, what, when you're 20 years old, you can figure out your path, you can make mistakes, you can pivot, you can turn in every direction and find something that you love to do.
Right.
But so many people, they feel stuck. They feel like they must fulfill some type of a path. Otherwise, they feel like a loser, right? And so this is why I encourage, anyone who have these intra-psychic conflicts to start seeing a therapist, because they could, having someone out there to help you navigate through those struggles and know what's norm and what's not norm may build a much more secure self.
Right.
And so while I was going through this match process in medical school, where you ultimately determine what field you're going to go into,
Right.
I get this call from a girlfriend of my brother saying that, what, he's acting really bizarre. Would you please come over here and see what's going on? And being from a minority family, and maybe a lot of families, there's not a problem until there's a problem.
Right.
So we turn a blind eye to some of the warning signals, like, him telling me how much pot he was smoking at the University of California, Berkeley, right? Telling me about, some of the recreational stuff that he was doing. And I figured if he was, going through school, if this was a cultural thing that was permissive in Northern California, and, who am I to judge? But the devastating phone call was that, he was feeling like people were after him, that someone was using him as an art project. When I got to his place, it was a mess. He literally saved maybe 50 boxes of, empty boxes of Domino's pizza containers, and saying that if I throw this stuff away, someone's going to use it. And I remember, at the time I didn't know much about psychiatry. I remember going out for a drive with him, and it was about, talking in codes and making sure that no one's listening to our conversation from the nearby cars. What do you do with that?
Yeah.
And nothing, as you know, Shay, I mean, you've been in the industry for a long time, but as you know, talking to someone with a delusion, a fixed false belief, is like talking to a brick wall. You can't
Right.
introduce logic.
Right.
Right. And so that was sort of the first entree into this helpless feeling as a family member, because I can't tell him that you could do X plus Y and then you can get Z. Let's get some help.
Yeah.
And it was a very helpless feeling. It felt like I had to go along with whatever delusions, otherwise he would not listen to me. So we played this game of, having him dictate what to do. And eventually I got him to move out of there and moved in with me to St. Louis for about a 3-month period of time. And I got to tell you, that was probably 3 of the most depressing months that I experienced.
So is this pre-diagnosis for him?
Yeah,
So
this is-
pre-medication, pre-any of that, right?
Pre-anything, right? That was the first warning that there's something going on. And so getting him to, acknowledge that he may be at a safer place, halfway around the country was helpful, but getting him to acknowledge that he needs help was difficult. We can't go to a psychiatrist because this is not something that a psychiatrist could solve.
Right.
And I really didn't at the time, as a graduating medical student, I didn't know really great ways of differentiating, major depressive disorder with psychotic feature versus schizophrenia. We, as a naive family member, I just think that, this is something that he's going through that will resolve. And we just got to get him some help and it'll be fine. And it didn't turn out that way, but I get to witness the, sort of the course of a person's struggle with mental illness in a very different way from a lot of people, because I kind of juxtaposed the experience as a family member with the clinical knowledge as I was going through psychiatric residency and seeing that sort of live and just raw.
So even in that place where you had some knowledge and you were a professional or in the works of becoming a physician, you were still dealing with the same thing that our families deal with
Absolutely.
every day, that are
Absolutely.
providing care, whether it's chronic mental illness or some type of just physical illness. It's a difficult journey.
How do you get someone who's reluctant to get care, to get the care that they need?
Yeah.
Right. And it's such a helpless feeling. And certainly it was a struggle even to, try to connect him to services.
Right.
What's the appropriate venue? How do we go about this? It was
Right.
overwhelming. And having to care for him for a 3-month period of time, was something I never did before. I never cared for anyone to that extent as a then 26-year-old.
Yeah. Right.
How do you motivate someone who looks depressed? How do you make sure that they're bathing? How do you make
Right.
sure that they're eating? How do you make sure that they open the drapes so that some sunlight can come in? It was literally so difficult living in a situation like that. And so that's, it's part of why sometimes I almost understand some of the struggles that families may have leading up to a client getting help.
Right.
Because it's not just something that happened yesterday. They've been dealing with this for months, if not years. Right.
Well, and I think you do such a nice job with our families that have been dealing with things for a long time. And we have this conversation about compassion fatigue,
Sure.
right? And that's something, if I'm understanding correctly, that's something that a provider can have, a person who's a therapist that's maybe working with somebody with severe trauma or
Sure.
something, or a family member, that they're caring for. And so can you explain, kind of what is the definition of compassion fatigue? Could you sum it up?
I think you're so vested, in a family member getting well that you end up devoting everything, all your energy to that project. And subsequently, you stop taking care of yourself.
Right.
And you let that project sort of be your existence. And sometimes you feel like you're the only hope for that person. When you stop taking care of yourself, you may actually not be doing your family member any justice in terms of trying to help them, because, you're going to stop, you're going to get depressed, you're going to end up getting anxious, you're going to end up not being able to help. You're going to end up having someone else try to help you.
Right.
And there's so many family members who I've talked to who just, who experience those same struggles that I experienced, as a caretaker. A different episode in my life back in 2018 when my father was diagnosed with pancreatic cancer. And even as a seasoned physician, pancreatic cancer was a very different space from
Right.
psychiatry, right? So I was literally trying to digest the treatment, the prognosis, the treatment, what can we do? And truthfully, I'll tell you that, I knew I was out of my league. It's not as easy, even as a physician.
Well, I think when you have a lot of knowledge about a field in general, right? Because and people say, oh, well, you're a doctor, right? That should make it easier, and
Right.
but it doesn't.
No, it doesn't. It doesn't. I mean, I'm just
You
not
get the same
right.
burnout and the same
Right.
exhaustion, and
I'm not that doctor, right?
Yeah.
I'm not the.
you don't know everything.
Right, you would think, right? No, I'm really good at forecasting things in psychiatry, but that's because I've been seeing patients every day for the last 30 years and know their stories and can almost forecast the progression of the illness very quickly after talking to a patient. But there was absolutely no vision for me when it came to pancreatic cancer. I mean, I remember, and I'm sure other families have gone through this and taking care of their loved ones, but I remember going through the Blue Cross Blue Shield provider directory for the Los Angeles area and literally just printed up 1,000 oncologists, right? I knew, logically.
It's kind of like throwing confetti in the air and just seeing where it's going to land, right? How do you know?
Yeah, right. I knew logically that was a futile exercise, right? I mean, how do I know?
Right.
Right. And, but there was just such a need to grasp for some control. that I had to do something. I knew logically as a, as a seasoned psychiatrist that, I'm not going to be able to envision his treatment. I can't do enough research to figure out what is the best path forward because
Right.
I've never seen it before, right? He's a sample set of one. In my field, I have tons of sample sets. I mean,
Sure.
this stuff is easy for me, right? But it was incredibly difficult, struggling with that helplessness, that need for some answers, that need for some control. And then taking, my father did well for about 3 years, and he very precipitously took a turn for the worse. And that was difficult for me as well, as, being a physician, knowing about death, dealing with death, knowing about, terms like palliative care and hospice. When I hear those terms as a family member, there's a very different emotion associated with it.
Of course.
And it was a tough situation where, I want to thank my wife and kids for being so patient with me during that period of time, but it was something that I almost had to completely devote myself to, to the extent of having cameras around. I mean, this is the insanity of being a doctor. I had cameras around, not to spy on him, but to make sure he's okay.
Yeah.
And, I had 24-hour care for him. And I understood that I had to work as a team with these caretakers. And it was not, having a camera just to micromanage and criticize. And that became really exhausting. It's being a caretaker takes a toll.
Yeah, for sure. At whatever stage you're at in your life, right?
Absolutely. There's, they never really had a course in high school about grief and death, right? And so, how do we approach things like grief and death? And, there's no playbook on this, right? And I know I was grieving. I knew things were difficult. And, luckily, I had, I've had help throughout my life in terms of a safe place to talk about some of this stuff, right? So that I'm going to be okay for my family and my patients, right? And, but, a lot of people tough it through. They feel like they have to take on the burden.
Tough it through or really compartmentalize, fake it till they make it.
Right.
That was my experience. I was the fake it till you make it girl.
Yeah.
My grandparents became my responsibility.
Yeah.
And my grandmother had Alzheimer's. And when we had her go into a facility, all of a sudden my grandfather just fell apart. Like he was super ill and none of us knew. He had COPD, which we knew, but we didn't really see how sick he actually was until he wasn't caring for her. And, I think that's pretty typical of a caregiver giving everything to this other person and leaving nothing for themselves. And then I found myself caring for him and realizing, okay, hold on. Let's slow down and let's think about what is it that I need? Because I had 3 kids at the time, 3 young kids. And so they needed something from me. My spouse needed something from me. My grandfather needed something from me. And I really had to just get to a place of saying, okay, somebody, like someone, help me. And I had this lovely woman who was a friend of mine, who's a therapist, and she said, let's just have coffee. And I said, listen, I don't need therapy for this. I realize that I'm in a really stressful time in my life. And she said, we're just going to have coffee. And she was therapizing me. Yeah, she was. But she was right. I was so busy with the caring and trying to make sure all the things were done and trying to make everything look great that I didn't realize how bad I looked actually, and how frazzled I was and how fried I was. And so I just started with some meditation and just daily time that I was investing in myself. So I started getting up earlier so that nobody else was awake. And these were just simple suggestions that she had made, of how do you care for yourself in those times? So do you have suggestions or ideas or things that you did to care for yourself or things that you recommend to other people?
Well, knowing you long enough, Shay, I know that, whenever there's a problem, you're going to volunteer yourself and you're going to go after it and solve that problem, right? And there are a lot of people like that around. And, but it's especially tough when you're dealing with, the health and the well-being of a loved one. It's, we can't be as objective, right?
Right.
And so we get very much, even as mental health professionals, we get emotionally wrapped up in this,
Yeah.
right? And it can be all consuming, right? You know, smart people know what they don't know. And so when you get to the place where you're trying to figure stuff out for yourself, you know, think about getting an expert to help you process. You know, a therapist probably has seen this scenario a million times. You know, and you're going through it maybe for the first time, maybe for the second time. You know, it's never easy dealing with the health and well-being of a family member, right? You know, and Shay, there's so many conflicts that can come out in a family system when someone is sick or dying.
Yeah.
And arguments between siblings. You know, in my case, I had to struggle with this Chinese concept of having to take care of your elderly,
Right.
right? And whether or not you're doing it good enough, right? And it's such a concept, it's such a entrenched thought within the Asian community. It's incredibly difficult to talk them out of that concept sometimes. But having a sense of obligation, you know, not wanting to fail. I mean, these are very difficult burden to take on. And so look, I recommend that if someone's feeling, you know, stuck as a caretaker, feeling burdened, okay, you know, find a therapist. You know, find a therapist who's gone through this type of scenario a million times so that they can maybe help you navigate your way through this, as opposed to trying to figure everything out yourself.
Yeah.
You know?
I think it's also hard to see there's also a lot of guilt and shame when you're taking care of someone, if you ever do anything to invest in yourself during that time.
Sure.
At least there was for me.
Sure.
There was this time of, you know, I should be doing this instead of, you know, going to get a massage or
Sure.
whatever those, you know, those things were. I think the spa is the answer for a lot of things. So.
Well, I mean, those little things that, you know, that helps you preserve yourself.
Yeah.
You know, and you know, being able to care for yourself. You know, if you start neglecting your own personal well-being, your own personal needs, you know, you got to start thinking, you know, am I suffocating as well, right? And do I have to kind of stop a little bit? And I know it's, you know, there's guilt involved. I know you play a critical, important role, but if you're so far down the rabbit hole, you know, you may need help at some point, and you won't be able to help others.
Right.
Right. And so make sure that you get the help that you need regardless. You know, take the shame component out of this, right? And just be able to acknowledge that you need a little help. There's a lot of anxiety associated with taking care of somebody. There's, you know, a lot of emotions, and it's okay to see a mental health professional.
Right.
You know, to just talk, to have, you know, or to have coffee with friends.
I think that it's hard to recognize sometimes when you are in those high stress situations that you're becoming desensitized to the things around you, you know, and that's, I think, a warning sign that you do need some help, you know, with things that are, you know, something that will make someone else gasp, but you just sort of let it rolls off like water off of a duck's back. There's a problem, right? Like, here's your sign.
Right. Right. I mean, there's a problem if you're crying watching an antidepressant commercial, right? You know, and, you know, there's a problem when you're not laughing at anything, right?
Yeah.
There's you know, and be able to acknowledge that, you know what, this is problematic and I'm burnt out.
Yeah.
You know, I need to get some help. That may be better for everybody else around you.
Yeah. One thing I noticed about myself when I was caring for my grandfather is that things that my kids would do that normally I would find funny or I would enjoy with them just were annoying. I just wanted them to, like, you know, just stop,
Yeah,
you
right.
know, and I recognized that I was becoming pretty abrasive with them, you know, because I had no bandwidth. Like, I had nothing left. I wasn't pouring anything into me.
Right.
It was all just going straight out, you
Right.
know, to someone else. And so I also think that's something that people should look out for, right?
Right. So, you know, when you crumble, there are casualties around, right? You know, your kids may not be used to this person,
Right.
right? Why is she all of a sudden screaming
So
at us
cranky.
for those for those silly jokes that we usually, you know, these
Yeah.
you know, redundant jokes. But yeah, you know, I think that, you know, being able to take feedback from other people
Right.
instead of getting defended, right? You know, I know that I have a family who's very open about, talking to each other. And I took feedback from my wife. I took feedback from my kids, just so that I know that, I want to still operate within a certain lane where I'm not going to cause a casualty to other people.
Right.
That I'm not going to displace anger on other people just because I'm stressed out about taking care of my father.
Right.
Right. And so that's really important to be able to recognize, other people not trying to be critical of you, but to kind of give you some warning that hey, you're not acting like yourself, and be able to take that feedback and not get so defended about it, but do something about it. Right.
Right. I think recognizing too that this for most people is not a short game, it's a long game.
Sure.
Right. And so to be able to sustain and maintain over the course of time, you have to have that go-to. So
Right.
whether it is a spouse or a professional or someone that you can talk to,
Right.
just to kind of download what's going on, and help you stay grounded and stay well is essential.
And if you're not a person who's open to vulnerability, get a therapist, right? If it's hard for you to reveal to your friends about the struggles that you may have, and I mean, think about the weight of carrying that burden of caretaking. And you have to be tough, and you can't tell anybody how vulnerable you feel. I mean, it's like being on an island in the middle of the Pacific, right? And you feel like there's no rescue in sight. I mean, think about what kind of a burden that creates for a person.
Yeah.
Right. And so having someone out there, even if it's a therapist that you hire once a week just to talk to, even if you get nothing out of it, just have someone there who's on your side,
Right.
who can kind of reach out to you if you're in trouble. I think it's priceless. Right.
It is priceless. Let's also talk about just some practical things. Like I told you, I would get up early just so I could have that time by myself, just sort of meditate for the day and focus. I probably hit 200 golf balls 3 or 4 times a week just because I didn't have time to play a full round of golf, but I could go to the range, And so, I mean, those kinds of things, are those equally as helpful, or was that maybe just my way of?
Yeah, I mean, I think everybody has different ways of, dealing with stress, right?
Right.
And you want to be, you want to try to unplug yourself from obligations. It is, it's an obligation. Let's face it, it's an obligation having to take care of somebody, right? And if, sometimes, I get that people like to go and have a round of golf to unwind, but sometimes they take that round of golf a little too seriously because there's a measure to it, right? It becomes something that you have to be plugged into. Try to figure out something that where it can kind of remove you from having to think about performance.
Right.
Having an extra burden of having to perform. Go to the spa and don't feel obligated to listen to the problems of the massage therapist and offer solution. Right.
It is okay to say, please don't talk to me.
Right. Absolutely. Right. And I think, being able to set limits, with yourself about how much you can accomplish, realistic limits so that you don't feel like the next thing that's going to be, that you're going to be saddled with is going to be the thing that's going to take you down.
Right.
Right. Make sure you have some limits set. Make sure that you understand what kind of activities would kind of unplug you from the obligations that you typically think about. Make sure you have people that you can reach out to, right? Whether it's a therapist or a friend from across the country who's not critical. Because I think a lot of times when we reveal vulnerability, we feel like people may criticize us, right? And so find that safe space where you can be vulnerable, discuss your weakness, and not feel like someone's going to judge you, right? And have that person around. And get into meditation, get into yoga, whatever works for you in terms of activities that would unplug you from having to think about the obligations.
Right. So just taking time for you, maybe a little bit every day, just to give
have some structure about that, right?
Right.
If it's not every day, every other day, right? Just something that you can look forward to where it's your private time where you're not saddled with the burden.
Right.
Right. And I use the word burden because it did feel like a burden, right? It's okay to admit that, I wanted to micromanage the care for my father.
Yeah.
Okay. But I knew it was a burden, right? I recognized that it was a burden. It's okay. And because sometimes people feel like, well, if I say that it's a burden, then, somehow I'm betraying my family member. No, it is. And be able to talk about that.
Acknowledging it for what it is and being able to put some action steps for yourself to it, right?
No, absolutely.
I think this is such a great topic that is overlooked a lot by so many people because, we're so busy providing care.
Right.
And as professional caregivers, right?
Right.
And problem solvers, it is something that you find yourself on that side of, on that side of the coin all the time.
Yeah, absolutely.
And I think that it's a discussion that, needs to continue to be had. We have it a lot, even with our team here, even, with our therapy team and our providers that work so diligently with our clients. There are times when it's like, okay, we're going to take a break and we're going to celebrate you today.
Right.
We tend to have dessert around here quite a bit. So we celebrate birthdays and we celebrate things. But so even in the midst of the stress and of caring for someone else and helping someone get to their ultimate goal, you still have to take those times to celebrate small things and to just pause and it not be about that person. Let it be about something more normal.
Right. And, this is a great environment to work in because, we have birthday cakes almost every other day.
They're very healthy, though. They're very healthy.
I'm not going to comment on that. I just
cake should be cake. It's okay.
I eat what's in front of me. But, I do think that, so many families, they go through this struggle and they don't realize the impact of caretaking on them.
Yeah.
Right. And I try very hard to, because of my experiences, I try really hard to think from the family's perspective, right? And I do include them in my thoughts, because whenever I get a client, it's not just the client that's, who's struggling. It's everyone around who have been through this adventure a week, a month, 6 months, a year, right? And they're exhausted as well. I mean, they're, a lot of times they're just relieved that, a family member is getting help and that they can hand this off to professionals.
It provides a little bit of respite for them.
Absolutely. Absolutely. It's, because it's like me trying to figure out pancreatic cancer, right? I don't know how to explain to you my 30 years of using psychotropic medications, right? In a 5-minute lecture, right? I don't know how many papers you have to read in order to kind of get some of the, I would say like almost algorithm and diagrams that I have in my head. Right. It's really hard to kind of provide that. But I think that it is, I encourage all the clinicians to, think not just about the autonomy of the patients, but the struggles of the whole team behind a patient getting to help. Right. Family members who have gone through this, I mean, they suffered as much as our clients.
Yeah.
Right. And it's a whole system that's been disrupted from an illness, right? They're casualties to the illness.
Yeah. I hate to say it, but we're out of time. It goes so fast. So I really appreciate you joining me for this discussion and for you just sharing some of your story. Any final thoughts on understanding the human condition from Dr. Frank Chen?
Well, I think the simple thought is that, don't be afraid to seek out a therapist or a psychiatrist. If you're smart, you wouldn't try to fix a car with black smoke coming out of the tailpipe, right? And, it's a fairly complex job, right? So why would you try to fix mental health issues?
Good. Thank you. It's a good one. Well, if you'd like more information on this topic, or if you'd like more information on J. Flowers Health Institute, you can reach us on our website at jflowershealth.com. Or you can call us at 713-783-6655. I would like to remind everybody watching and listening that there are numerous places that you can find our podcast: YouTube, Apple Podcasts, SoundCloud, Spotify, iHeartRadio. So please feel free to tune into any of those to see our upcoming podcast and share on social media if you think somebody would benefit from seeing this. We want to also remind you that the clear diagnosis is key to getting the best treatment possible. So we are always happy to help with that. Hope you have a wonderful day. Thanks for joining.